Now we are happy to recognize the gentleman from Iowa, Mr. King.
Thank you, Mr. Chairman. Appreciate the opportunity to raise this issue before the Rules Committee, and I think it's probably none of it a surprise to anybody on this committee on where we are with this. And I will just tell you that I'm asking for a waiver. I concede that if I bring language to the floor under an open rule and appropriations that has the word notwithstanding in it, it's it's an alarm bell that will cause a point of order to be raised, and I will concede that that point of order is very difficult to argue that it's in order under the rule. We are at this point with this CR. This is the maximum amount of leverage that we will see in this 112th Congress. And the amendment that I'm seeking a waiver for is the amendment that shuts off the funding for the automatically appropriated Obamacare legislation. Most in this Congress were not aware that that was written into the bill. We dug into it as recently as last week, and working with the CRS, they did publish a report on Friday that totals $105.5 billion in automatic appropriations that are written into the Obamacare bill. And that is, those appropriations spanned out over 10 years. Some of it is loaded in different ways, but one just might think in terms of $10 billion a year. And because this House has voted to repeal Obamacare, and we've already voted as a majority of this House to remove all sections of the bill, of Obamacare and the associated reconciliation package, my amendment just goes in and uses the model that I pulled out from my memory of the Vietnam War era, actually, where there's language there that was in a CR. They did it in several ways, but one was, the primary one was a CR in 1974 that stated, notwithstanding any other provision of law, no funds appropriated or heretofore appropriated shall be used for defensive or offensive operations in Vietnam or the adjoining countries. I went back and took that model and wrote that into my amendment essentially as a standard. And the rationale is this, that first, the automatic funding. We saw the legislative maneuvering that passed Obamacare, and that was part of what came up. First we pass the bill, then we find out what's in it. Most of us on our side of the aisle campaigned to repeal and defund and deauthorize Obamacare. We've taken the first step to repeal. The next step is to defund. And the effect of my amendment would freeze in place the implementation of Obamacare. We recognize that 2 federal courts have ruled it unconstitutional in all or in part, and therefore for us to continue to fund an unconstitutional piece of legislation is a burden on us, having taken our oath of office to uphold the Constitution of the United States. I understand that there's a rules conundrum here, and gentlemen and gentlelady, I'm more sensitive to the burden that's of the Rules Committee, gentleladies. I'm more sensitive to the burden of the Rules Committee than probably any time in my now starting the 9th year here. However, I would make the case that we do take the oath to uphold the Constitution, not the rule. And I followed the process that one would ask a responsible member to do, in that I requested that my language be written into the bill. It was not. This is the next stop along the way, and it's the last stop before the floor. There's been much discussion about letting the House work its will and about regular order. Well, I would submit that regular order on an appropriations bill would be perhaps hearings before subcommittees, markups before subcommittees, markups before the full committee. At 2 of those 3 stops, there would have been an opportunity for a member to offer my amendment, in which case it would have been in order, and had it passed, it would have been written into the base bill with or without the cooperation of the people that make those decisions on what's written into the bill. So I've done my due diligence. That's my argument. I've done my due diligence. I believe that my amendment passes the floor of this House if it's allowed to be debated, and I have a degree of confidence in that. That is, the dedication to the rules is something that you in this committee have to be more sensitive to than any other members of this Congress. And yet, the dedication to the Constitution is what all of our oath is to. And so, I'm of this position that I want the House to work its will. We didn't have regular order, or my language would have been voted on by now someplace along the way. This is the last stop before the floor. I want a regular order, but I want the House to work its will. And I'm asking this committee to grant a waiver for my amendment so that there can be a debate on the floor and a vote on the floor. If we do this, we're consistent with our oath of office. We're also consistent with fiscal responsibility. It's not in a one-year cut that would be $105.5 billion, but over 10 years it would be $105.5 billion. It's the only tool that I know that freezes in place the implementation of Obamacare. And if we let it grow, then it grows its roots down in, and it gets harder and harder and harder to eradicate. So I wish there was an easy way to take this cup from all of you. And if there is a way, I'm open to hearing from that. At this point, I have carried this ball for a year and a half. It's been the primary issue that I fought against before it was passed, and now fought to repeal it after it was passed. And I'm not in a moral position to make concessions that might diminish the responsibility to finally repeal Obamacare. But I am in a position, I think, to turn my ear to the people involved here in this committee and to leadership if there happens to be a solution that is better than the one that I'm offering. And I would yield back my time to the chairman.
Thank you very much, Mr. King. Let me first express appreciation to you for your extraordinary dedication to a cause that I know that every member on this side of the aisle shares. Every single member here has cast a vote to repeal this outrageous health care bill, which I believe undermines the potential for job creation and economic growth and dramatically expands the size and scope and reach of government. And legislation that did unfortunately pass and was signed last March is something that I believe is potentially very, very dangerous. And I share that. And I appreciate your recognition of the challenge that this committee faces on this issue. It is true, we're trying to have the most free-flowing, open debate possible under a structure that has, under a continuing resolution, which it's not been done before. And the one thing that I can assure you is that we are going to pursue every possible means that we can to make sure that we don't fund this program. Throughout the process, throughout the last 18 months when you've been working so diligently on this, I said all along that I thought that the natural step for us would be to take the mandate, which hires up to 18,000 new IRS agents to enforce the mandate. And I will tell you that I've read, I was just talking to Daniel Webster, who happens to be a good friend of Roger Vinson's, the judge who offered the brilliant 78-page decision. I've read every word of it. In fact, he quotes some of my favorite framers, Federalist 34, which was authored by Alexander Hamilton, and the two authored by James Madison, 45 and 51, in which he points to the constitutional questions of this. And so I will tell you that my lawyer and I actually went through it together, every one of the 78 pages of the Vinson decision. So I will say that I share the goal of getting exactly where you are. And I know I can't speak for my colleagues on the other side of the aisle here, but I know that I speak for all of my colleagues here when I tell you that we do. And I want to get there. We know that we are now 5 or 6 weeks into this Congress, and I believe that personally that we need to proceed with as open amendment process as possible, and I respect your desire and willingness to continue to work with us so that we can get to exactly where we want to be as we proceed. Mr. Sessions.